Pediatric orbital malignancy is a serious healthcare problem where regular follow-up acts as a key factor, and how to overcome them in collection of data in lost to follow-up patients. We have included 32 cases. Out of 32 cases, 20 cases were from rural background and 12 from urban background, mainly slum areas. The connectivity of the remote areas is very poor due to heavy rains, waterlogged roads, underdeveloped and abandoned bridges. Without the help of local residents, it is quite impossible for motorized vehicle to resume its journey. The nearest healthcare center or visit to an ophthalmologist requires 20 to 25 kilometers of walking on foot or riding bicycle. Few buses that ply on these gravel roads are the only mode of transport to the nearest town. Often the buses are so crowded that it is difficult to carry the sick. Sources of data in rural areas are totally different from urban areas. In rural areas, village headmen and panchayat officials are the key resource person for providing data. Often vehicles get stuck on the mud on the way with no other help available except from the local people. Certain low-lying areas can be assessed only by country boards. These areas remain totally cut off from the main population during monsoon, when heavy rains and poor climatic conditions isolate these people from rest of the world. Our visit to the houses of the patients who have been lost to follow-up depicts the sad tale of death due to the disease. This is another family who has lost one child due to the disease. We saw the melancholic face of Dickie's child parents who had no option other than surrendering to fate. His elder brother recalls the memory of his younger sibling. In several occasions, we sought help from the local student leader and some NGOs. We also seek help of the village headmen who could finally guide us to locate the cases. This video will encourage the government, social, political and health service personnel to utilize the resources and to organize programs on community and cultural awareness in those areas where no infrastructure exists and only ignorance prevails. We have also noted the socio-economic condition, their means of livelihood, hygienic condition, etc. These hanging bottles of insecticides along with food material and hair oils give us the idea how much they are ignorant about the health hazards of these products. We have gone through their records in the last follow-up and advised them accordingly. We have spent hours after hours in the medical registration department to find out the address of those cases who did not turn up for review. Sources of data in urban areas are totally different from rural areas. Without appropriate address, tracing cases in urban areas is a difficult task. We found out the temporary address of the rickshaw puller from the rickshaw bank number or owner's phone number from the file. Then we have located the owner and thereby traced the rickshaw puller in the early morning hours before he resumes his work. Sometimes we have been able to trace them only at night to collect the data. A few paramedical workers and doctors working in the government healthcare centers in some remote areas have also made immense contribution in providing us the required data. It was heart-touching to see the services rendered by them, and this has given us a ray of hope in our minds.